had a little fire at home. We're burning in a burn barrel, some cardboard, and some of it toppled out. I had my back to the burn barrel, and it ignited onto one of my pant legs, and it went very quickly up. It's been burned right up to the thigh, and very deeply in some places, so there's been a substantial infection.
I was at home and I was making French fries on the stove using a pot, and I went to take the pot off and move it, and a bit of oil touched the burner and the flames come up, and then I had the pot in my hand and I dumped it and burnt both my hands, down my leg, and both my feet. I'm burnt right up from like the tips of my fingers right up. They did skin grafts.
Burn injuries are a global public health problem. The fourth leading cause of injury worldwide, severe burns can have a profound and debilitating impact on individuals and their quality of life.
So, a burn injury is a trauma that changes a patient's life. We also know from studies recently that the paradigm was before that once your burn wounds are covered and done, you healed, which is wrong. Burns continue to burn basically in you, being inflammatory, being stress. Your scars may be red, you get contractures. You never feel the same for a long, long time.
Yeah, I can't do the stuff that I want to do. It's kind of cut back on some of that stuff, like with the kids and stuff like that.
It also has a very unique response called the hypermetabolic response. Hypermetabolism means the burn injury affects everything. Every organ, every tissue, everything in your body. Brain, your lungs, your heart, liver, kidney, and you name it. Everything is affected. In order to maintain your organ function, in order to maintain survivability, you need to have proteins, amino acids to deliver energy, your brain. And this hypermetabolic response consumes all of these.
Glutamine, an essential building block of protein, may be associated with reduced mortality and better clinical outcomes for severe burn patients.
So glutamine is an amino acid that has inflammatory reducing properties. What we know is glutamine is significantly depleted in burns. It's very, very downregulated. So to administer glutamine is hypothesized to be beneficial. The questions what we need to know now is when to give it, how to give it, the dosing to give it.
The Re-Energize study is a multi-center research project. It will follow 2,700 patients in ICU burn units around the world to study the use of glutamine to treat severe burn patients and improve recovery and survival.
We're leading the world in doing the largest ever trial of seriously injured, burn-injured patients. Our hypothesis is that glutamine will reduce mortality at 6 months out from your serious burn injury. We also think that glutamine will reduce your infectious complications. It will preserve muscle, and therefore your up and go, your physical recovery will be improved. Patients with burn injury have a high risk of dying, and those that survive suffer considerable morbidity. And we're offering them a relatively cheap nutrient that can increase their chances of survival, and if they do survive, aid and speed and enhance their physical recovery.
In order to realize the full benefits of this study, we need your help. Your investment in this groundbreaking project will allow us to extend our study globally and provide dedicated research resources to focus on the results and translate our work directly into patient care and survival.
Part of what we'll be needing to do over the next 4 years is raise an additional $2 million to support the completion of this study. Randomized controlled trials is really how we figure out in medicine whether things work or not. So the funding really is to pay for the patients and the costs of putting a patient on study, implementing study procedures, and collecting the outcomes. So it means a lot to us to get to 2,700 patients so that we have adequate numbers, so that we have sufficient statistical power to answer the question. And so it's a first step towards a great network that, in the years to come could study other solutions or strategies to aid in the recovery of burn-injured patients as well.
We have a need in order to advance the outcomes by doing clinical trials that answer important questions. And one of the important questions we realized, particularly coming from the hospital, we realized how important nutrition was. If you have a really important question, you need thousands of patients. And this is one of the trials that has an extremely important question.
You want to make a difference? You want to impact the outcome of seriously ill, disadvantaged patients? Invest in the research that we do.